Now the basilar part. The basilar part has three surfaces: anterior surface, superior surface, and inferior surface. The anterior surface articulates with the basilar part of the sphenoid to form the spheno-occipital joint, which is a primary cartilaginous joint. It is atypical. And the superior surface, it is called clavus. The inferior surface has pharyngeal tubercle, and it is attached with the pharyngeal raphe, and two muscles are attached in here. It is called the rectus capitis anterior and longus capitis. It has three borders: two lateral border and one posterior border. Two lateral border, it articulates with the petrous part of the temporal bone, and the anterior border, it form the anterior boundary of the foramen magnum, and one membrane is attached in here. It is called the atlanto-occipital membrane, and the midpoint, it is called the basion. Now the angles, the three angles, it develops from the lambda, and it develops from asterion. And two lateral angle. So now the superior angle, it articulates with the parietal bone. The inferolateral angle, it articulates with the temporal bone. The inferior angle, it articulates with the mastoid part of the temporal bone. The two lateral part of the basilar part, it articulates with the petrous part of the temporal bone. The anterior surface of the temporal bone, it articulates with the sphenoid bone, and the inferior surface of the basilar part, it articulates with the atlas. Now the foramen magnum. The attachments are the apical ligament of Dens, then membranotectorium, then the lower end of the oblong medulla oblongata and meninges, then the spinal rami of the accessory nerves, then right and left vertebral artery, then spinal nerves,